Big FM podcast.
You are listening I Believe in IVF, presented by MCure Pharma, powered by Materna.
We are presenting a unique patient awareness series by MCure Pharma, I Believe in IVF, powered by Materna. MCure is a pioneer in gynecologicals and a preferred partner in IVF. So very warm welcome, doctor. May I ask you about yourself a little bit? Where do you belong? Where did you study? And how is your experience working in IVF? Please tell us.
I'm Dr Shivani Sachdev, Director of SCI IVF Center, New Delhi and Noida. I'm from Mumbai, Maharashtra. I've done my graduation and post-graduation from Mumbai, and my higher education is from Edinburgh in Scotland and Imperial College, London. Working in IVF from the last 20 years, and it has been an extraordinary and an absolutely lovely experience, I must say. Family is the basic unit of our society, and having a child is something which is so inborn. Parenthood is like a greatest blessing of life, and we have been fortunate as a team to be able to help so many thousands of couples achieve this dream. So it has been a wonderful experience.
Ma'am, also tell us what are the unique services you offer to patients?
We offer fertility treatment for both men and women, and the advanced technology, for example, IVF, ICSI, laser-assisted hatching, blastocyst culture, genetic testing of the embryos, donor gametes, and surrogacy. So we offer the entire range of fertility treatments under one roof. Most of the patients that we come across have faced some form of social isolation or stigma or apprehension with regards to IVF, like cost or transparency of the process. And because of that, they are hesitant to adopt this technology. Especially during COVID phase, safety issue is also a barrier. So when we see patients, we try and take care of all these things so that we give our patients the best treatment possible.
Great. So ma'am, can you please explain us what is IVF and what was the most challenging case you have come across?
IVF is one of the most successful forms of assisted reproductive technology. It is a technology to help you get pregnant and have a baby. This is a very complex series of procedures, and not only to have a baby, but also it is used sometimes to prevent any genetic problems in the child. The woman is given daily injections for about 12 days. After that, mature eggs are collected or retrieved from the ovaries under anesthesia. It is a small process. These eggs are then fertilized by sperm in a dish. Although this is called as test tube baby, the fertilization process takes place in a dish. And with regards to one of the most challenging cases that I have faced, I will never forget throughout my life a patient who came to me after doing 40 IVF cycles in Japan, and she was sitting in front of me, this little thin woman, and just in complete and utter despair. And it was really like a miracle that the first IVF we did with surrogacy, and she conceived and her healthy children were born after 9 months. So it was something so unbelievable, where 40 treatments did not work. One attempt of surrogacy was immediately successful for her.
That is truly a miracle. Yeah, it is. So why are the patients of IVF increasing in India? Why do you think it is happening?
Worldwide, we have seen a decline in sperm parameters. There is also a trend of late marriages, late pregnancy, decline in egg quality, environmental factors like pollution use, pesticides use, even mobile phone use, stress. All these factors are playing an environmental role in contributing to the increasing rates of infertility.
So ma'am, what is that this most common myth that you have heard amongst patients with regards to IVF?
This is Dr Shivani Sachdev, Director of SCI IVF Center, New Delhi and Noida. The most common myths that we come across almost every single day is there is a mistaken belief some women have about robust fertility, the effect of age on fertility. People think if they have a healthy lifestyle, if they have a family history of fertility, they will not face infertility even in their 40s. Sometimes they get incorrect information from friends, from physicians, from some reports about celebrities who are having children in their 40s. So because of that, they feel that the fertility lasts for a very long time. So this is one of the most common problems that we see in our day-to-day practice.
You were listening, I Believe in IVF. It's not only a campaign, but a movement.
Big FM Podcast.